Hello, my name is Brad Harness, leader of Reform Ontario, and I'm here today to talk to you about Reform Ontario's smart healthcare. Keeping Ontarians healthy is another key responsibility of the provincial government. And despite what both federal political parties and the media have to say on the subject, healthcare is purely a provincial area of responsibility. Having said that, we must acknowledge that Ontarians want their healthcare system to be there when they need it, to be simple to use, to be effective and affordable and responsive within a reasonable wait time period. Most Ontarians like the free aspect of universal health care, but they don't like the delays a publicly funded system causes, especially at moments when time is of the essence, as in critical illness or emergencies. Can Ontario's health care system be better? In a word, yes. First, our starting point is your family physician. Many Ontarians still lack a family doctor. Reform Ontario's solution is for the province to recruit and train all new general practitioners. They will be hired as doctor trainees, be salaried, and would not incur any tuition or medical education debt upon graduation. In exchange, they would be posted to wherever they're needed across Ontario for a period of time equal to the years spent in medical school at government expense. During this period, they would be salaried Ministry of Health employees, and upon concluding this period of service, the new doctors would be free to relocate or specialize or both. Reform Ontario would apply the same strategy to alleviate the nursing shortage for nurse training and employment upon graduation. Having addressed the need for doctors and nurses at our initial point of contact with our health system, next up is diagnosis. Reform Ontario would allow for the provision of private diagnostic services for a fee. Ontarians are already going to Buffalo and Detroit for such services, and doctors here do not always regard these test results as legitimate. Under our plan, the travel and cost would be reduced, the results forwarded to your family doctor promptly, and be regarded in the legitimate sense that they're given. We would allow private medical clinics to operate fee services should Ontarians choose to spend their own money on such medical procedures. And after all, they can obtain cosmetic surgery already. Why not something more useful, more closely related to their health outcome? This will reduce wait times for everybody else and reduce medical tourism to other countries with some of the unfortunate spin-off effects that has produced. It would also create a medical tourism industry right here in Ontario, creating new jobs. Next up, hospitals and emergency rooms. Ontarians tell us that they feel they have lost control of these vital institutions in their communities. Ontarians tell us they're very unsatisfied with the local health integration networks, the LHINs. These agencies have expanded past their original advisory purpose and now make funding decisions that were previously the purview of the Ministry of Health. They make decisions often clearly against the interests of local municipalities where the hospitals are located. Reform Ontario was the first party to come out against LHINs when they were created, and we will shut down these agencies and return the oversight role to the health minister, while the day-to-day operation and funding would be transferred to their local municipality, increasing local decision-making and providing better health care solutions for you. Finally, while the province pushes preventative medicine, why is it that optometric, dental, naturopathic, and chiropractic care is fee-for-service and not covered by OHIP? Reform Ontario believes that we should each have more say over solutions to our individual health problems and challenges. To that end, our Health Freedom Voucher would allow you to spend your share of the healthcare budget on the healthcare services that you feel are right for you, giving you more control. Thank you.